Ladies and gentlemen, our bioethics responsibility to each other is not over, and politics has nothing to do with it. What this means is that the Center for Disease Control and Prevention of 2021 has documented what they call vaccine breakthrough infections, but they knew this would develop. Maybe you're asking, what is a vaccine breakthrough infection? Well, it's simply a respiratory toxin in a fully vaccinated person after 2 weeks. So today we're going to talk about a short preview of 6 main points. We're going to talk about CDC data, news reports, and media versus politics, how political arguments has undermined the national recovery efforts, a history of school vaccination requirements, current account of hospital making requirements and those efforts being tested, a brief counterargument, and a proposed pandemic accountability solution. So the CDC has explained that the virus variants are on the rapid rise, and this threatens the progress of the United States in ending the pandemic. We know that the United States has joined the battle to fight the COVID-19 variants, and unfortunately some of us have followed these protocols with the hope that they could produce a vaccine. As of July 6th, the CDC of 2021 has communicated that up to 5,186 fully vaccinated people still contracted COVID-19. As of July 9th, ages 18 to 49 accounted for more than 40% of those hospitalizations, and ultimately, those people died from their infections. You see, the CDC SARS-CoV-2 variant classification explained the more you allow infection to spread, the more variants are produced, and the more variants are produced, potential deadly versions can emerge. So as of July 9th, the CDC reported that the Delta variant made up 51.7% of all reported cases. They also documented that it spread more easily. This was a jump of 23.9% in cases in June 15th, but between the two dates, that was only 25 days later. So breakthrough infection status due to these variants that are in circulation has now produced asymptomatic infections up to 1,028 cases, 3,554 cases of hospitalizations, and unfortunately 733 deaths. So basically, the CDC has said that these people must have gotten infected just before they got the shot or right after they got the shot. But regardless, they still got seriously sick, or some of them died. So what seems to be a reigning theme throughout this pandemic is the asymptomatic condition. But do you know who and where these people are in order to protect yourselves without the protocols? Well, there's hope. As of July 10th, the CDC has reported that 159 million Americans are fully vaccinated. Pfizer's lead the way with almost 85 million, Moderna at second with almost 62 million, and Johnson & Johnson almost at 13 million. Unfortunately, Atkins of 2021 said there's another factor gnawing international efforts, and that's politics. So let's discuss politics without the critical thinking, because it's dismantling our national recovery. Lawful undisclosure policies are preventing our bioethical community efforts from adhering. So basically, they're providing the unvaccinated who know they'll not be asked if they're vaccinated a way to continue risking the health of the vulnerable. They now are free to move around without the vaccines. Individually, they can relax the protocols, and we're none the wiser. And the undisciplined and the uncompassionate are now have provided a clear path for the virus to the vulnerable. So this whole thing has produced a political geographical argument. So the U.S. Central South and Eastern regions are now weakened by these gubernatorial opinions to policies. These orders are being issued despite the negative effects. So Atkins of 2021 confirmed that the Florida governor has issued an order prohibiting federal and local businesses from requiring proof of vaccination as a way to protect personal privacy and bolster personal freedoms. The Texas Governor Office of 2021 has confirmed that the Texas governor there has implemented similar orders protecting routine lives. And Diaz of 2021 has confirmed that South Carolina has issued a similar order to include schools. So myself, as an environmental health and safety EHS coordinator, I've been told that I can't ask for employees' proof of vaccination, but this is due in part because my company has aligned itself with the states. So now, we know that we already have a history of requiring disclosures of vaccines for schools. So how's this any different? You know, schools require vaccinations before kids and students get involved with sports. So according to Long of 2016, 68% of colleges in the states require proof of these 2-dose varicella immunization shots for attendance, and they've always enforced that. Florida of 2018 has had vaccination laws in place in order to maintain low rates of vaccinating preventable diseases. They've also had public and private schools as conditions for attendance, and vaccine laws to help protect healthcare workers in efforts to reduce outbreaks. South Carolina has had vaccination laws in place right up until the pandemic. Basically, DHEC and schools work together to make sure that the kids' vaccinations are up to speed prior to registration. And now we have an example of a hospital in Texas. So, according to Stengel of 2021, 153 Houston Methodist Baytown hospital workers were either fired or they resigned because they didn't want to get the vaccine. And out of those 153, 117 filed lawsuits. They basically said that they were part of an experiment and that these vaccines would wind up being dangerous. Well, a judge responded back saying, if you didn't like the hospital rules, you can go work somewhere else. So here's a counter argument. Where's the critical thinking that said it's better to not verbally disclose the vaccinations? So if someone lies, they're potentially responsible through DHEC traceability. So where's the critical thinking that was used to make a differentiation from required sports vaccinations to COVID-19 vaccinations? Because you think about it, if you verbally reveal that you're vaccinated, what are they going to do with that information? And personally, I've revealed that I've been vaccinated to some people, and people have reciprocated kindly saying that they're vaccinated. So why not a pandemic solution? How about we continue to follow the CDC guidance, lawful, and this time allow lawful verbal or visual disclosures? So if we continue to follow the CDC data, we can now make informed and critical decisions of how to protect one another. So these lawful vaccination verbal disclosures can now allow everyone, especially the vulnerable, to make informed decisions who to protect themselves against and how they're going to do so. Folks with underlying conditions can follow do the same thing, and folks who just received the shot or just about to get the shot can do the same as well. So these disclosures would also automatically provide the unvaccinated and the anti-vaxxers a healthy pressure. This would force them to either use the protocols against their possible asymptomatic condition or confirm they have the asymptomatic condition through a test or to get vaccinated. But finally, the plan that I like the most is a nationwide effort for federal, state, local agencies that could issue a clothespin. This clothespin can be worn to let folks know that they're vaccinated. This protects the need to know health information and signals to the vulnerable that you're protected without you having to say anything. So in conclusion, we talked about the CDC COVID data, news reports, and other media that battles against politics, how political arguments do not support a national team effort but only knock it down. History has proven that vaccination requirements were okay then, and it's even more important now. How hospital efforts to protect patients was tested, and the opposing arguments were only selfish. Brief counter-argument that was based on critical thinking, and a proposed pandemic accountability solution using clothespin to signal safety to others. So the data has shown that fully vaccinated can still get sick, and taking political sides doesn't help. The only way to beat COVID-19 variants is a nationwide coordination. This cannot happen if you don't know who to turn to. So how about somebody whose job is to know the data? Well, Riley of 2020 has revealed that the CDC, the HWO, the FDA, the NIH, and HHS, and each state, county, and city health departments are these experts. They can provide you the resources that you can use to do your own research. Well, thank you for joining me today on this discussion, and help keep each other safe.